Hello, I'm Ronnie Eldridge. Welcome to Eldridge and Company. Of course, it's important to have health insurance, but sadly, that isn't enough to ensure good health. Studies show that too many Americans, an amazing 9 out of 10, lack sufficient understanding of the health information they are given. The health literacy movement is changing that, and two of its leaders, Helene Eisman and Anna Ellen, are my guests today, and they're going to tell us what this movement is all about.
Essentially, what's happened in the healthcare system is that the system's gone from treating acute kind of emergency situations to treating long-term chronic illnesses, helping people manage issues that are ongoing. That's how healthcare is changing. The system itself hasn't changed to support people doing that. So most people, you have 1 out of 2 Americans who are managing a chronic illness, which is a huge number, but the system itself actually doesn't really support them. They can give them medications, they have doctors who specialize in these things, but no one's going home with that patient, no one's telling that patient this is how you take your medications, these are things you need to be doing in your life. You need to be dialoguing with your doctor around what your issues are and what your needs are that are perpetuating your symptoms or your condition or alleviating them or whatever the issue is. So the patients on a patient-by-patient basis are not getting that individual support they need. Patients don't know how to gain those skills to manage their illnesses, and the system isn't really helping them gain those skills. So the system, the burden has gone from the system managing short-term chronic emergency things to doing nothing to aiding a patient managing these longer-term issues.
But can we call it, in a way, it's illiteracy? I mean, if the patient doesn't understand. But wasn't that always happened, didn't it?
But medicine is there's so much more medicine, and it's so much more complex. And it used to be that a doctor would give you a directive, do this, do that, and we would go and do it.
And we had so much respect for the doctor that whatever they said,
that's right.
was it. You never questioned them, right?
And there weren't all that many options. Mm-hmm. So now we have to go home. We've met people who do their own chemotherapy at home. Mm. And that's a lot to manage. It's a lot of choices and decisions to make. So not only is the onus on the patient to do the self-care, but it's also what are the risks and benefits of a particular medication? What kind of specialist should I see? I mean, it's just an onion that we keep peeling and peeling and peeling. We've done workshops where we've just had to spend time talking with people of how to make an appointment because it can be so complicated, or how to get in to see a doctor soon. It's at every point of entry has gotten difficult.
That making an appointment is getting more and more complicated, I think, as the doctors and the practices change.
That's right.
It's really impossible. But it's also incumbent, I mean, there's another side to this question, is the doctors never really knew if the patient understood what they were saying, right? And the communication. We didn't even know if people could read or not. Isn't that true?
It's true, but also medicine didn't require the patients to do as much as it does now. And an example of that is, it used to be when you had surgery, it was very invasive. You were in the hospital for months.
Oh, right.
And the hospital was caring for you during that time. But as an alternative to that, my mother actually had a brain tumor removed last year, and she had surgery at 7 a.m. She was out of surgery by 2 p.m. She was in the ICU for 24 hours. She was in a step-down room for 24 hours, and then she was home. And so everything that the hospital was doing to care for somebody who had just had a brain tumor removed, my family had to do. Yeah. So we really needed to step up and ask questions, and we had to recreate this incredibly complicated care by ourselves. I mean, it was a really difficult responsibility to assume, very complicated and very potentially dangerous. So that's one of the ways that the system has changed. That onus again is on the patient. It's not always on the provider. So we had to, and we didn't do a great job, but we had to ask all these questions that when she was being discharged. We had to make sure we had the medications correct. We had to take them, when to take them, what to do if something happened. That's a lot of information a family of caregivers has to take in and understand.
Right.
And then in one of our very first workshops that we did, so SayAh is an organization that
we're going to get to that wonderful name.
but we work with a lot of different patient populations, and we go and we do workshops, and we give them these basic skills that they need to manage their health. And at one of our very first workshops, someone came up to us afterwards and said, can you teach me how to use my glucose monitor? And we said, well, we're actually not legally allowed to do that. We don't give out health and medical information, but as health literacy specialists, we advise you to go back and call your doctor and say, can you do this? Can you teach me this? And he said, I can't. I've been reporting fake numbers for the last 6 months. So that's, people are ashamed that they don't understand this stuff. They don't know what to do when they
They're
major problem.
Yeah.
They're overwhelmed.
And many times they don't know they don't understand it.
Right. So how do you do it? First of all, how do you do this? How did you meet?
We were brought together by someone to write a piece for women like a shower card for breast self-exams. And we hit it off. We started doing other work together, free screenings for uninsured women and so forth. And what we started to notice was that...
You're writers.
We're both writers. Yeah. And we started to notice how many things were kind of going off the skids in health. And some of it seemed like, as writers, we could pick out, you know what, it would really be helpful if we were having better conversations, if people could ask questions and they felt they could. You know what, just because there's communication, it doesn't mean it's good communication. Mm-hmm. So if you need to give good information and get good information, hold on to it, be able to use it. Like that would really help people with their health care. So by 2007, we became a nonprofit.
And you're called?
SayAh, as in open your mouth and say like at a doctor's office. But it's also like, I understand now, you know, and to step up. That's right.
It's from the old women's movement, a click of consciousness. That's what they're talking about. Right.
Exactly.
So now what do you do and how do you do it?
Well, we start out by writing a lot of tips. We look at different research. We test things out that we're writing. So we have basic tips for people. And we also kind of work both ends of the stethoscopes because we believe that physicians and care providers, social workers, patient navigators also need to learn skills for better communication. And we go in and do workshops with different populations. We do trainings where we'll talk with doctors, for example, about teach back and other ways to make sure that their patients are on board and they understand what's happening.
I read someplace that if you say to a patient, do you understand, you're not going to get a good answer because it's the same thing. They'll be embarrassed to say they don't understand.
Exactly.
Or they don't want to take up your time to go through it all.
So we would say, can you say back to me in your own words how I just described how to clean your wound or what to do when you're taking medication? Is it with food or not with food? And it takes a special kind of person who's been trained one way to think about health care and delivering health care a little bit differently by engaging the patient. I mean, we're all about empowerment, right? This is about letting people know that they have a voice, that they can speak up, that they can follow their gut. And it's a beautiful thing when you can find physicians and other people in the healthcare system who feel that way too, because they believe, and there's studies out there, that then you're getting better health, you know?
Absolutely. It's estimated, I mean, it's a lot of expense attached to not understanding what's going on. Billions of dollars.
$238 billion was the estimate in 2007, and we all know that healthcare costs have only increased since then. So that number's got to be higher.
What is that? Emergency room things, or worse illness?
It's everything from
early mortality.
I mean, low health literacy has been strongly linked to increased hospitalizations, and that's really where so much of the costs are. Medication errors, people suffering worse health outcomes because they're seeking care later. They don't know where to get care. I mean, this is a huge problem. I mean, our system is so complicated, and we struggle with this. Something happens, you're like, who do I call? it's very difficult to figure out who you should be calling. Many, and then they die earlier and of more preventable causes because they have low health literacy. They don't know they can get that care. They don't know, again, like this person who came to our workshop who couldn't use his glucose monitor. That's a very a common thing. People don't understand how to use their medication devices their medical devices, or to take their medications correctly.
We really saw the impact, like under a microscope, as it were, for Hurricane Sandy. Because that's when you saw people running out of medication, losing all their medical records, and they hadn't saved them, or they had completely depended on the doctor's office to keep them, and then they didn't have it. People who, for example, take insulin for diabetes, that has to be refrigerated, but they had no power, and they had never had the conversation with their doctor, what if? What if I run out of power? Can I use dried ice? How long would it last on its own? When doctors hear that, they think, oh, I've never had that conversation. So you kind of got to see in this sort of microcosm of how things could really get complicated and dangerous. Absolutely.
So what happened to all the people with the records that just disappeared? And if you didn't understand, you were really in trouble.
You really were in trouble, sure.
Is this considered a public health? Does it fall within...
It's a hidden health epidemic. I mean, honestly, it's really a huge problem. And, it doesn't generate income. I mean, having people understand how to do things doesn't make the healthcare system wealthier. There's health literacy certainly hasn't made us wealthy. I mean, there's not.
But there is an economic bottom line. There
is a huge benefit.
People.
Well, there's a huge benefit to the society, and but people are unaware that people are really unaware that this is a problem. And we look back at our own behavior, knowing what we know now. I remember stopping to take medications because they made me feel so sick, and I would never say to my doctor, "Oh, I stopped taking that." Now we always say, tell your doctor, because your doctor's going to think you're on that medication unless you tell her or him otherwise. But
doctors don't read minds, and it's a tough one to accept.
That's something we've learned and changed in ourselves. So if we didn't know about these kinds of things until we started really getting deep into it, most people don't either.
So you've embarked on a particular area and project in Chelsea?
We have.
In Manhattan?
We have. Right. We after doing years of workshops and trainings and speaking with policymakers to say, hey, health literacy should be a part of this conversation. Even something like making medicine labels, bottles.
I was going to ask you about that. Pharmacies, who controls that? Is that a state licensing thing? Do they require what goes on a label?
What we understand is that what's on the label is required and the insert is required, but what's not required is like those inserts that come with the medication are itsy bitsy teeny weeny.
Oh, they're awful.
They're awful. And so we would love to see legislation, for example, where that is bigger and it's easier to understand what's inside.
I'm so sorry.
Go ahead.
Because we work so hard, we finish each other's sentences. Try not to do that. But the other thing is that the information. I mean, this is a big component of health literacy. Information. Those labels are a great example. It's what's consumers don't have a seat at the legislative table around health information. Mm-hmm. So what we want to know about our medications isn't necessarily what is being told to us, on the medication labels, and it's certainly not being prioritized. So, we're not saying what's on there we shouldn't know, but as a consumer, I want to take this. This is, what are the things? What do I need to know to take this medication?
You got to get more political. I mean, the consumer is the voter, right? And Chelsea happens to be in the district of the chair of the health committee of the assembly. So
exactly.
Let's go to work.
Exactly.
Right.
All right.
And,
okay.
And it's all for what we're doing.
Right.
Yeah. I mean, we felt like what we came to understand is that for someone to have more health literacy, adequate health literacy, they have to be supported in lots of ways, right? And we felt like, what if you were to take a neighborhood, Chelsea, which is diverse in every possible way, and start laying in a health literacy infrastructure, best practices, as it were? What if all the organizations there were kind of in on it, and they were adopting best practices? What if storefronts had signs that said, ask your doctor questions, tell your pharmacist all the medications you're taking, and so forth? So we said, okay, let's do that. Let's redirect a little bit and concentrate on this particular neighborhood where we've done a lot of work over the years in workshops and so forth. And we started speaking with different sites, different organizations that we've worked with before to say, we want to do this. We want to do this for several years. We want to see if your clients and patients start asking more questions. We want to see, will they start bringing their medications with them every time they go to a visit? Are they feeling more empowered? Is your staff feeling more empowered? Do they feel like they're having better conversations and people can follow directions and so forth? So that's what we're doing.
So you go into different places and arrange from what to what?
We're partnering with community organizations like the Hudson Guild, to New York Presbyterian Center for Special Studies. I mean, a wide variety that serves a wide variety of populations, really from 0 all the way on up. And this first phase is really about going in and doing workshops. And hopefully we're going to start doing trainings and then roll out actual messaging throughout the neighborhood. So the launch will be in October, which is, believe it or not, it's
almost here.
Well, but it's Health Literacy Month. Nobody knows.
That's it.
So
You have to come back. It's in an area where the local hospital has left, although there's an emergency facility now.
Healthplex, yes.
Do doctors tend to be in areas around major hospitals? Has anybody ever looked at that?
Their offices. There's certainly in New York City, there's the cluster.
Yeah.
But it depends where you are.
I just wondered if Chelsea has the same amount of doctors that other places.
They may not, but that's sort of the point, is that your health is everywhere.
Yeah.
Every interaction we have is about taking care of yourself, wellness, maintaining your care, right? So that was part of our attraction to Chelsea, is that it has diversity in terms of organizations, in terms of what's being served and who's being served. And that, we think, is really how you have to support this. That's really the movement. That's how you move that dial.
Do you go to schools?
We haven't in the city yet, although...
How would you do that?
Well, we've gone to schools in that we've gone into workshops at trainings for people becoming nurses, for example. We've been at some PTSAs, talking with parents and teens about if you're going to a doctor's office for the first time, how do you do that? What do you need to know? You know.
Well, you started that. Basically, that's how you started, isn't it, for women under 40 with mammograms?
Well, that's how we started.
Yeah, that's
and
what
we
I
learned
meant.
a lot about good communication
Yeah.
around that.
And, the other thing with schools is, one of the things that we also focus on is in health literacy. And again, health literacy are the skills that you need to access, understand, and use health information and services. But part of those skills are knowing your rights, knowing what it means to have confidentiality, knowing what the privacy laws are. So you can better talk to your doctor and feel more comfortable saying, this is really what's going on in my life. People need to tell their doctors things to get a accurate diagnosis that they wouldn't tell their parents, or they wouldn't tell people at school, or maybe even their friends. So so actually supporting adolescents, this is a huge problem for teens. Supporting them in understanding how they're supposed to conduct themselves and what their rights are in that interaction with the doctor is a very big part of health policy.
I'm thinking it while you're doing this. I mean, nobody would call me shy, I don't think. But I know when someone close to me is in the hospital, I'm intimidated by the whole system. I don't want to go out to the nurse's station and say, listen, we need you. Why haven't you come earlier? Or to the doctor, I have a friend who's a doctor. He makes rounds at 5 o'clock in the morning so he doesn't have to see family members.
Right.
I mean, that's, it's funny, but it's really not.
It's
But
not.
it's apt. But that's
So it is a question of your rights and how you're supposed to be. And it goes along in a way with the I don't mean to say lowering of prestige of doctors, but they're not high on a mountain. We should be communicating.
You should be
person to person. Yeah.
You should be, as Helene said, you should be partnering, and that navigating that power dynamic is so difficult for so many people. And for people who suffer from low health literacy, again, we spoke earlier about this, but you've got that shame component to it. So you have to, you have a lot of very marginalized, disenfranchised populations that suffer higher rates of poor health, and they really have a difficult time advocating for themselves in the healthcare system, and they need to say, I don't understand this, or can you say that to me in regular language?
Or I need a translator.
Or I need a translator.
I was going to say, we haven't talked about speaking a different language.
That's a whole...
Yeah.
Yeah.
What we find is that a lot of people here speak English as a second, third, or even fourth language.
Yeah.
And we see oftentimes children, grandchildren, great-grandchildren, little ones, are the interpreter, literally going in with grandma to a doctor, and the doctor's talking to the child, and the child's talking to the grown-up. It gets back to rights. People may not know that they have a right to an interpreter. And it is about literally speaking up and saying, I need help. One of the things that is interesting is we hear a lot, particularly with seniors, that they don't want to ask for help. And medicine's just too complex not to, frankly. There's too much to do and to know. And, I don't want to bother my daughter-in-law, she's so busy, kind of that attitude, or wanting to maintain your independence and not seeing that asking for a little bit of help can go a really long way. It's the other reason that we wanted to work with organizations in Chelsea is let them be the helpers. Let them model, hey, we're here for you. And I think they're very happy to step up and be that for their clients and their patients. They see that as their role. And caregiving is a whole huge blooming.
It's another thing, right?
Yeah.
When you said they're entitled to an interpreter, if you're in a hospital?
As long as a hospital or center, health center is getting some kind of federal funding on the books, that means they need to provide an interpreter. Yeah.
So you tend then, if you don't speak the language well, to find a doctor who speaks your language.
That's
if
right.
you're just in a private practice.
That's right.
Whatever you call it, a family doctor, right?
That's right.
How many people in the country do you know are illiterate, that they can't read in any language?
I'll give you the statistics on New York City because they're not what people think they are. We think of this city as being very articulate and sophisticated. The rate of, it's really, they don't say illiteracy because you can be able to read a word but not know the meaning, or you can be able to read a sentence and not be able to interpret it. I mean, literacy is very nuanced.
Yeah.
So the rate of sort of functional illiteracy in Manhattan is 25%. It's over 40% in the Bronx. But 25%, that's a huge number. A quarter of the population here is functionally illiterate. Nationally, for health literacy, because you have to have a very high level of literacy to be able to navigate the healthcare system, nationally the statistic is that half the population, almost 50% of the population, is functionally illiterate in the face of our healthcare system. And there's a variety of reasons for that, part of which is that most healthcare information is written at a 10th grade reading level, and the average reading level across the country is 6th grade. For people who are on Medicaid, Medicare, the average reading level is at a 5th grade reading level.
Isn't that interesting?
So
people who are writing instructions for medicines and everything, they're deliberately writing it. They're not, or are they writing it?
We don't
know.
You can't say. Like we know a lot of social service agencies that also deliver their information, and these are people who work very closely with people who have a low educational attainment, and they still deliver information in a high literacy way. It's sort of like the last. I want to say in some ways it's like the last bastion of maybe the disability movement. That illiteracy is very poorly understood, and even with people who work with populations that are functionally illiterate. So the healthcare system, are they doing it on purpose? Certainly, one could make an argument for that. But also, there's a lot of other organizations who fall into the same
And
trap.
there are drug manufacturers that are not in this country, so they're not even. Don't they do the instructions?
There's that as well.
Yeah.
I mean, one thing that we're sometimes brought in to help create plain language versions of materials, right? And and have it accessibly designed so you can actually read it on the page. And sometimes there's a worry, particularly from a communications department, that it's being dumbed down. And we push back on that because there's a difference between making something easy to read and understand and use than dumbing something down. There really is a difference. So
we're in our last seconds.
Okay.
What are some of the rules you would say? First of all, AHA website is AHA.
it's say-ah,
Say-ah.
ah.org.
Yeah.
Yep.
Okay. Now, what are the first things you want to tell somebody?
Take notes when you see your doctor. Always bring all of your medications with you, or take photos and bring those with you.
Ask questions.
questions.
Be honest. Many people lie to their doctor. You have to actually go out of your way to be honest. If money matters to you, it matters to your health. Talk to your doctor about what your medications cost, what your health insurance is costing. Try to find cheaper alternatives. Don't be embarrassed. Don't be ashamed. You didn't go to medical school. It's okay not to know this stuff. And then our final tip.
The doctor doesn't know how to market. Go to the supermarket. Go on.
One of the most important things you can do is to always understand instructions and directions. And to do that, as Helene said, use the teach back method, which is to teach back the instructions or directions to your doctor.
And look at the website to the viewers, and good luck in Chelsea.
Thank you.
Thank you. If there are any people you'd like to hear and topics you'd like us to explore, please let me know. You can write to me at CUNY TV, 365 Fifth Avenue, New York, New York, 10016, or you can go to the website at cuny.tv and click on Contact Us. I look forward to hearing from you.